What's going on, everybody? My name is Dr. Andrioni. I'm the physician at Cannabis Doctors of Florida, and we're about to talk about the routes of administration, the first one being smokable. All right, guys, so starting with the cannabis flower, aka marijuana, weed, herb, ganja, bud, plant, tree, leaf, I've even heard. Regardless of what it's been called, smoking cannabis is arguably the most popular method of consumption for recreational and medical cannabis users. There are many ways that people can use flower, like smoking it or vaping it. Patients will even buy the flower to make their own edibles or tinctures too. In this video, we're going to be focusing on smoking flower. In the registry, it's known as the smokable route. If the physician finds it appropriate, the patient will be allotted up to 2.5 ounces every 35 days. When you break it down, it's about 2 grams a day, which really isn't that much.
Or is it?
When you smoke cannabis or THC in the form of flower, the psychoactive effects are generally felt within minutes, if not sooner. All right, take a seat, we're in class. When we inhale THC, it goes directly into our bloodstream via our lungs. From there, it goes through the heart and straight up to the brain. And guys, THC is lipid soluble, so it crosses the blood-brain barrier very easily. From there, THC will bind to the CB1 receptor in the brain, and the rest is history. The bioavailability of cannabis in the form of smoking ranges anywhere from 2 to 60%. Of course, this is user dependent based on the depth of inhalation, how long they're holding their breath when they do inhale, the temperature at which the cannabis is burned, and then we have to think about all the cannabinoids that get destroyed by pyrolysis and lost to the side stream smoke as well. In cannabis naive patients or infrequent users, the effects are generally felt for 3 to 4 hours. This will decrease to about 1 to 2 hours as you get more comfortable or use more frequently. This can be avoided if patients are only smoking cannabis sparingly or in an as-needed basis. So regardless of the use pattern, the acute onset, the predictable duration of effects allow patients to easily titrate the feeling of the cannabis within a relatively short period of time. And after all, this is desirable to many patients. So the rapid onset of effects is great for when you need something right now and not in an hour or so. To compare, when you look at an edible or tinctures, they take a little bit longer to kick in and they usually last way longer. So these are more preventive measures. So the advantages of flower. It's great for sporadic or episodic symptoms such as headaches, pain, anxiety, nausea, even sleep. It's easy to titrate due to the predictable duration of effects. There is little to no maintenance required. And lastly, but maybe the most important, with the flower, you are more likely to feel the entourage effect, which we will touch on in another video. But long story short, the entourage effect is the medicinal benefit that you will feel from the total sum of the components in the plant. Alrighty, now what about the disadvantages? So although this could be a good thing, cannabis flower is super pungent and aromatic, so in terms of being discreet, it's the exact opposite. Infrequent cannabis users may find smoke irritating to the lungs, and on the flip side, chronic use may be associated with respiratory symptoms such as phlegm, cough, or bronchitis. What's more, burned plant material produces carbon, tar, and the polyaromatic hydrocarbons, and that's never good either, so that can increase your risk for cancer. If you add tobacco to the cannabis, that increases your chances even more because of the tobacco aspect. And one more downside that I kind of mentioned before, but up to 50% of the active medicinal component in the plant material can get lost to the side stream smoke or incarcerated or destroyed by the pyrolysis. And maybe one more downside to the flower is that you might over-medicate if you're not comfortable or if you're a new patient. So I can't stress this enough or reiterate this. Start low, increase very slowly.
Start low, increase very slowly.
There are multiple ways to smoke cannabis flower. A water pipe, a bong, a pre-roll or just a joint, a bowl. There's an even better method to using cannabis flower, and that's to vape it in a dry herb vaporizer. This is the safest way because you're not overheating or combusting the plant material, you're just heating it up to the temperature at which the trichomes and the cannabinoids will be raised into the air. You can even reuse the same volume of flower because you're not overburning it. I would highly recommend finding a dry herb vaporizer that suits your need and using that if you do choose to use flower. All right, guys, so a good practice for patients to avoid any over-medicating for new patients or naive patients. You want to just take one inhale, wait 5 to 15 minutes, assess for any changes in mental status or in any symptom changes. If there's no change, you can take one more inhale after the 15 minutes and then reassess in 15 more minutes. If you do feel something or you feel that the symptom has decreased or there's been a change, then you don't need to do any more inhalations. Wait and see how it feels. Whatever dose that you started with, make a journal, mark it down so then you know the next time to either use that dose or a little bit more if this first dose did not help you. All right, guys, so to sum up the flower route, acute onset, predictable duration of action, and easily titratable. In addition, the flower route is great for episodic or breakthrough symptoms, or you can just use it sparingly or as needed too. The real main disadvantages is that you could over-medicate if you're not too comfortable or familiar with cannabis. Some of the cannabis medication gets lost to the side stream smoke or destroyed by the fire or combustion. And there's an increased risk of carcinogens when smoking. If you found this video helpful, please like and subscribe, and I'll see you next time.